Hi, good evening, everyone. I am Richa Sarah, Editor-in-Chief, Responsible Hospitals, and today I would like to welcome all of you on our Insta Live session. Today's session is all about weight loss, something which is quite painful, something which somebody and everyone is looking forward to for any diet plans for losing the weight in a different manner and how surgeries are important or not. So we're going to talk about all that. So I would have Dr. Mayank Madaan with me. Yeah. Thanks everyone for joining this session. We're gonna start it very soon. Hi, Dr. Mayank. How are you doing?
I'm good, Richa. How are you?
Thank you so much. So I'll just
Nice to
start
see
with
you
the
again. Yeah,
introduction. Uh, so Dr.
yeah,
Mayank Madan, who is with the CK Birla Hospital right now, having 15 plus years of experience with minimal access, bariatric surgeries, and much more into it, and having a great experience with weight loss surgeries. So, Doctor, today we're going to discuss about this subject, which is weight loss surgeries. What are the myths about it? What are the solutions to it? Because I'm sure there are many people who are facing obesity issues, but frankly they are not much aware that is surgery safe, whether they should go with the surgery thing, or whether they should keep opting for the diet plans, till what extent they should wait. So we're going to talk about all these questions from
yeah.
now on. To start with, it's pleasure having you over here, and we'll start
Same,
with my
same here.
first question, which is what do you think, what is obesity?
See, obesity, if it means overweight, someone who is overweight and is not able to reduce it on its own, we call it obesity. But to go into technical terminology, I'll say that people who have a body mass index of above 30, they are to be categorized as being obese. So common language में इसको मोटापा बोलते हैं, तो उस चीज को हम obesity बोल रहे हैं. So body
Sure.
mass index, I think you people must be having an idea.
Sorry, come again.
Body mass index,
Yes, BMI.
something known as BMI. Yes.
Yeah.
So for a normal individual, normal BMI should be somewhere between 20 and 25. So it's a correlation, or I can say it's a kind of ratio between your body structure or your height and weight. Okay.
Mm-hmm.
So for a normal individual, it should be between 20 and 25. So anyone who is above 25, we call them overweight. And someone who is above 30, we categorize them as obese. Then above 35, we can call them morbid obese or category 1, category 2, category 3 obese. But it's primarily, it is calculated by knowing the BMI of the person. So anybody above 30 is an obese individual.
Sure. So, doctor, we will go deep into it, into the subject. So, what are the side effects of people who are obese?
See, obesity as such impacts each and every aspect of your life. I'll say each and every aspect, right from the way you look, right from the way you function, right from the way each and every organ of your body functions. So if you start right from, if you go from above, people who are overweight, they are definitely having some sort of anxiety issues, depression issues. Then there can be something known as pseudotumor cerebri, in which people have um, headaches, migraines. Then coming down, people have difficulty in breathing. We call it sleep apnea. People who snore a lot in the during nighttime. So it is called OSA. Coming still further down, people have issues with hearts, cardiac issues, hypertension. Coming still below, all the organs in the abdomen, they can be involved. Like primarily, I would like to focus on diabetes, because type 2 diabetes is definitely related with obesity. In fact, a quite quite high number, I'll say more than 70-80% of obese people who come to us for surgical procedures, they are having type 2 diabetes. Coming to your joints, your back, everything is involved, everything is impacted with obesity. Still down, uh, people have problems having fertility issues, pregnancy issues, carrying the pregnancy throughout, all these issues, PCOD. Then joint issues like knee joint, all these things are directly or indirectly related to obesity.
Sure. So, doctor, are you saying so it is very important to calculate the right BMI to check whether you are
Yeah.
obese or not, and whether you
Yes.
require a proper treatment, about it, right? So, well, what do you think? Since you just mentioned that it really impacts our whole body mentally and I would say physically, which you are
Yes.
clearly mentioning, what is the right stage when they know that they have obese and they should actually need a right treatment or let's say surgical treatment? What is when it is early? I would say, is there any age criteria or any female who passes through a certain age only she can get treated? So what are the age criteria? I would be more specific to it.
See, for age criteria, I'll say, first of all, one has to be, like the first question you asked me, the first of all, one has to be aware that he is turning from normal individual to an overweight individual and now getting into obese category. So one has to be observant of his weight. You get my point? So
Right.
unless you are observant about yourself, about your body, you would not really know that which category you're going into. So yes, you should calculate your BMI. We all know how our body is behaving. If you're feeling quite lethargic, if your sizes are increasing, so all these things you should keep in mind. When coming to the technicality, when one should be actually be aware, then definitely anybody who is above 25 BMI should definitely have a look at what he's doing to himself, because that is the stage where that is the correct stage when he or she can actually control the weight gain. From between 25 to 30, we definitely say you can try different measures like dieting, exercise, yoga, pranayam, a healthy lifestyle. All these things you can still control your weight. But once you go beyond 30, yes, now is the exact time that you should definitely go and talk to some of your doctor friends or doctors or dietitian or maybe some gym instructor or somebody. Now you should definitely be taking yourself very, very seriously. Okay. But for surgical point of view, if you say who people require surgery, then uh, as per the scientific literature, people who have a BMI more than 37.5, okay, that means more than 50% of your normal body weight. Say for me, my normal body weight should be around 70, say. Okay. So if I cross that threshold of another 35 kgs, that means more than
Okay.
50% of excess body weight I'm having, then that is the time that surgical option would be great for you. Or there is still little more relaxation in this relaxation, I would not say. Um, People who have BMI more than 32.5. 32.5 BMI means once you cross 20, more than 25% of our excess body weight. Okay.
Okay.
Plus any of these problems like sugar, hypertension, dyslipidemia when your cholesterol is haywire, or heart diseases, then even at 25% of excess body weight, you should consult a doctor. That's when surgery can help you. So exactly to say, if you're 70 kgs is your ideal body weight, then if you gain another 17 and a half, plus all these any of these problems, as I told you, sugar, blood pressure, heart disease, or cholesterol issues, then you should consult a doctor, and surgery is definitely indicated in these individuals.
Sure. So, having said that, doctor, you just mentioned about when it is required actually, what is the exact need and timings. There must be a lot of people who are quite worried about the surgical procedures and they're not sure whether they want to, get surgeries, because surgery is a term which everybody, feels a little scared about, and they think about, future aspects about it, like, what could be the repercussions, what could be the side effects later on, how can your body can be affected later. So there are a lot of myths actually. I would want you to actually tell us how these surgeries are done, how important is for every client or patient to know about it, that how these surgeries are performed and how it affects your body, I would say, how your body performs thereafter.
So all the surgeries nowadays for weight loss, there are almost 10, 12 different procedures which are described for weight loss. All these surgeries are now done by minimal access route. Common language, you call it laparoscopy. Okay.
Okay.
That means there are no big cuts involved. There are only small holes that we make in your intestine, in your tummy. And the way you eat, the way you metabolize, the way you absorb the food, all that is changed inside. So that is a keyhole surgery. So there is no need to get worried that you're going to get big scars or the recovery period would be too long. Like people who get open surgeries, they are on bed rest for 3 weeks, 4 weeks. I can show you people who undergo laparoscopic weight loss surgeries and they are back to their work within just 4 or 5 days. In fact, they're
That's
back to their
absolutely
sitting jobs.
amazing.
So this is a very big myth that surgery, yes, surgery is surgery, no doubt about it. But the access is now keyhole. Access is now minimal access. So recovery period is very short after this. There's no need to worry about the bed rest part and repercussions in that way, I'll say.
Sure. So, do you think when they come back with the surgery, do they find themselves totally changed, a different person? Is it a magic? How does it go?
Definitely. If I could only, if I had only recorded the people who come back to me and saying, "Doctor, can you recognize me?" And I have a look on my face. Yeah, maybe. And then they just scream in delight. I'm so thankful to doctor. I am this, I am that. I got this surgery done six months back or 7 months back. It's a life-changing surgery. As I told you, people are changed physically, mentally, emotionally, functionally, every which way they feel good about themselves. And the best part is, once you see yourself in the mirror, whether we accept it or not, everybody wants to see himself or herself nice. And yes,
Obviously.
we all want to feel energetic because life is not just about living it, life is about enjoying it as well. So people just means the exclamation, I'll say. It's an exclamation mark I'll put on all the remarks that they give.
So that's really wonderful of you because I'm sure you are changing a lot of lives every day, and when they are, they actually feel the magic that this can happen to me, and I'm sure many of us they live whole life, cribbing about that I'm so fat, I really can't do anything about it, and they waste a lot of time in the diet plans, and it is not easy actually. Diet also it's required a lot of, I mean, efforts day in day out. And when you are obese, I think, do you think that the lifestyle change, the diet can also help them to change the way we do it in the surgeries?
Yeah, definitely. See, uh, people who are overweight, definitely we encourage them to go for first diet plans.
Mm-hmm.
It's not like that people will enter my clinic and I'll just tell, okay, no, no, come, you are only a surgical candidate.
Mm-hmm. Yeah.
That you should try some exercise, you should exhaust all other means. You should deserve the surgery first.
Mm-hmm.
But yes, people who are having other comorbidities, like told you, sugar, uncontrolled sugars, then yes, surgical option. Can you hear me? Can you hear me? Hello? Hello? Yeah, yeah,
Well,
fine.
yeah, I'm losing the network. I can't hear you right now.
Okay, just give me a second. Let me try. Now?
Yeah, I can hear you, but I think the screen is blurred. The screen is not clear. Can you hear me?
Yeah, I can hear you. Yes.
Yeah,
Do you?
Yes, I can hear you now. It's going back. I think I've lost the network again. You there? Yeah. Let's go ahead. It looks fine to me
Yes, yes,
now.
yeah. Okay. So, see, there is one example which I quote to everyone who comes to my this. They say, Doctor, I did dieting. I lost 10 kgs. But
Mm-hmm.
as soon as I left the dieting, I got back another 15 kgs. Some
Okay.
people would come to my clinic and tell me, Doc, I'm going to gym and I have already lost 15 kgs.
Mm-hmm.
So I think I can carry on with this. I tell, okay, carry on. It's up to you. Till the time you exhaust yourself, you should try that. So, but at the same time, I give one example to them that there is Newton's first law of inertia. I think most of the people would be knowing. It's a law of inertia which says that something, if it is lying here, it will keep on lying here only, unless you apply some force to move it. Okay? The same law of inertia works
Mm-hmm.
for your body weight also. Now, after a while, your body accepts certain weight range to be its normal. Like if I say for me, I have been somewhere around 65 to 70. For last 25 years, I have been this way. Okay. And most of us, they would be recognizing that they have a pretty good range in which their weight is stable. So there is inertia of weight. This
Mm-hmm.
is what I say, this inertia of weight. Now, for an obese person or an overweight person, your body has accepted yourself to be, say, 100 kgs, maybe 120 kgs, in that range. So now you have to apply some kind of force. That force can be, they say, dieting, that force can be exercise, that force can be yoga, that force can be gym. But at the same time, to move the inertia of your weight to its normal side, the force has to be persistent. It has to be persistent. The effort has to be persistent. And this is where most of the people fail. They do dieting, they will lose 10 kgs, they will lose 15 kgs, but for how long? They may do dieting for
True.
2 months, 3 months, 4 months, and then they just give up. And at the same time, the weight starts coming back because it becomes a tug of war. Same happens with gym. People
No,
go to
true.
gym, they lose weight 10 kgs, 12 kgs, they can't they stop going to gym after a while. They gain
True.
back the same weight. So it's a tug of war. It's a tug of war between your body weight or your body the um, and the effort that you're applying, which is not really persistent all the times.
Right.
So
Absolutely.
you have to have a force which is acting persistently so that your body weight inertia shifts totally to its normal.
True. True.
So
So,
that's where surgery helps. That's where surgery helps because surgery will keep on working. It will keep on working persistently, whether or not you're doing some dieting, whether or not you're doing some exercise, or whether you're not doing any effort on your own. But surgery is definitely doing that effort.
sure, sure.
So
So these days it's found actually that even small children, they're also obese, and teenagers, they look really big, they are quite fat. Do you think for them also the surgeries are the options, and how do they maintain?
see, most of the times childhood obesity is either due to hormonal effects or
Okay.
it is due to the eating habits. For for children, I definitely recommend if they are overweight, then you need to restrict and you need to really observe what they're eating, how much they're eating, what portions they are eating, what kind of food they are eating.
Yeah.
And usually with lifestyle and eating changes, eating habit changes, you can manage the childhood weight gain. But at the same time, if it is not going away, then you need to see a doctor because there are certain hormonal issues as well, which need to be seen into, looked into, which can be causing overweight issues with children. If you've ruled out all these things, then yes, surgery can be an option, but not in childhood. Usually, it is offered in late teenage.
Okay.
See, we have been doing these surgeries for patients above 18, now.
Right.
17, 18 is now the threshold, because by then the hormonal milieu of the body is stabilized. The person knows the pros and cons of the surgery, what's going to happen to him.
Mhm.
So usually we try to avoid surgeries before 17, 18 years of age.
Okay. Until what extent it happens to be? I mean, for old age people, what do you think? With them, can we do
For
surgeries?
old age, see, if we go by literature, then people up to 65 or 70 also they can undergo this surgery, because nowadays life expectancy is quite good. Okay,
Mm-hmm.
so um, mm, people live up to 80, 85 also. So somebody who is 60, 65, if we can give him another 20, last 20 years of life, which are good for him, he is not bound to the bed. He is not dependent on the kids or other individuals once he loses weight. So why not? And
So I
yes,
think
then it becomes your,
as early as you take the decision, it's really good for us that you live happily with the confidence you actually require to live in the
yeah,
society. Because a lot of people
yeah,
just, stop, they actually waste a lot of time within just checking out stuff. By that time, I know, they can actually feel more confident. They can actually face a number of people and,
yeah,
they can be more participative. They lose time. So I think for them, when
yeah,
they know already that this is the problem and this could be the solution which is available, since you have clearly mentioned that there are no side effects to it and it's quite easier these days with very, with minimal access and since you just mentioned about the keyhole surgeries ways. So I think this is something which somebody can actually look into it. Somebody who actually wants to know more, they can just come and discuss with a doctor. They can just tell what they have, what expectations they have, because I'm
yeah,
sure the females who are not married yet, they would have different kind of questions that, will there be any marks to it, will there be any other kind of side effects after surgery, whether I'll be able to conceive
mm,
or not, could be anything. So I'm
yeah,
sure, because a lot of you clearly mentioned that there are a lot of people who are females who are facing PCOD, which is anyway common, but I think this
yes,
is also affecting them a lot. So if the surgery is something which can be helpful, they can actually look into this option and they can actually talk about what are their expectations with their own doctor, and they can be more comfortable understanding the whole way of surgery. So clearly, going ahead with this fact, I would really like to know, once the surgery is done, you said within 6 7 months they can actually start expecting the right results, that they can see the beautification part, they can see the magics. What all they need to really take care afterwards? Do you think then also they would require to follow some strict diet plans, strict lifestyle, medications? What do you think about it?
no, see there, as I told you, there are a number of procedures, almost there are 10, 12 procedures which have been described. Simplest of them being sleeve gastrectomy, I'll say, in which we just cut short the stomach, which is a reservoir of food initially.
Right.
Then the other procedures are like the procedures where we change how the body absorbs the food.
Mm-hmm.
Okay, so in the procedure where we change the absorption pattern, then definitely you need to be on some sort of food supplements, vitamin supplements.
Mm-hmm.
So vitamin supplements like vitamin B complex, calcium,
Mm-hmm.
and some protein supplements, they need to be taken for your life, because you will not be absorbing them properly. Okay. So in
Right.
that case, I tell them, okay, if I'm giving you an advantage of
Mm-hmm.
losing this much weight, of losing your medicines for sugar or hypertension or heart disease also, then I'm just giving you just a small capsule of B complex that you need to take throughout your
Okay.
life. That's it. Okay. But in other procedures which are restrictive, as I told, sleeve gastrectomy and all, we usually don't prescribe any supplements nowadays to these people. We just tell them to come, get your levels checked every 6 months, and if anything is lacking, then only we supplement. As far as dietary restrictions, yes, we tell them uh, just stop where your tummy tells you that it's full. Listen to your body.
I mean, that's all.
See,
Not like
we
that you
all
have to just
yeah.
stop eating and have only one half chapati in a day or
No,
like
no,
that.
no, no.
Strict diet plans.
Here I tell that we all eat into our minds. We don't eat into our stomachs. We eat into our minds. It's in a mindset that, okay, morning I have to have one parantha, two paranthas. In the afternoon, I'll be taking three chapatis. I'll not be getting out even if I'm full. I'll be still be eating. Likewise, so eating habits, these are habits. Can you hear me? So you
Yeah,
need
yeah.
to change that habit. Once these surgeries are done, you definitely feel fuller
Mm-hmm.
easily. है ना? So at that time, you have to listen to your body. Okay, I have had half a chapati or maybe one chapati and I'm feeling full. Then you don't listen to your mind. Don't listen, kid. I used to eat three chapatis. Now I'm full with one. So I should be eating more. So you have to change that thinking pattern. You have to be observant. So
True,
this is
true.
what's required.
Sure. And how much time does these surgeries take? Is it a big surgery, which is like somebody should be
As I told
scared
you,
about? Is it a, how much time
as
does
I
it
told you,
take?
it's a keyhole surgery. Usually 1 to 2 hours is a surgical time,
Mm-hmm.
and normally most of my patients, more than I'll say more than 80%, 90% of my patients, they are back home within 24 hours. 90% of
Like,
patients are
wow.
back home within 24 hours. Rest, if
Mm-hmm.
we are doing some, say, malasoptic procedures, then maybe up to 36 to 48 hours. But usually 48 hours, by the time more than 99% patients, they are back home.
And you
Oh.
also said one point that people who are already having BP or let's say sugar, diabetes, these kind of issues, they also get resolved after these surgeries.
Yes. In fact, people who are having hypertension, almost studies show 80 to 85% resolution in it.
Mm-hmm.
80 to 85% resolution of hypertension after one of these
Really?
surgeries.
This is
Yes.
wow.
For sugars, the impact is even more. For short-term sugar, like if people have sugars for let's say last 4 or 5 years only, they are only on medication, only tablets. Then
Mhm.
more than 90% of people they leave their medication there itself, then and there in the hospital. They
I think this is
have
one.
such a brilliant control over sugars after any of these surgeries. Same happens with the cholesterol issues. Almost 80-85% cholesterol issues they are resolved. So it's not just about losing weight.
Absolutely.
It's about being healthy. It's about
Maintaining your whole body
curing.
weight and your system, and I would say a lot of other physical
Yes.
issues also. And you just clearly mentioned
Yeah.
about the hypertension thing. I'm sure everything
Yeah.
is, mostly I would say this is a problem of almost every fatty person, that they would have either BPs, diabetes. They either can't live their life with enjoyment because they have to eat
Yes.
their medicines every day for BPs or let's say diabetes. I think it's better to take a turn on the other way, because wo bhi theek hoga. On the other side, they will also feel happy looking themselves
Yes.
in the mirror. They'll be more confident. They will not have any physical issues. So I think it's like a life
Yeah.
changing experience, I would say. It is not
Yes.
only a surgery, it's like a life changing. You are actually changing a lot of life,
Yes.
as I
Yes.
said. So I think I'm done with my question. Anything you which I missed and you would want to add on, or any message
Um,
you would want to give it to the people who are facing obese, or if they have any family members in there,
so one thing I want
who,
to tell, one
yeah.
thing I want to tell everyone is people and people around these fatty people. Okay, they have this conception that it is a lifestyle disease only. Okay, they think that that this person grew fat because of his own sins, because he was eating more. He didn't have that healthy lifestyle. But
Right.
now more and more studies are coming which show that obesity itself is a disease. It's like any other disease where you need help. Okay?
Absolutely.
So there's no need to make those people conscious that it is because of yourself. It might not be. A lot of people have obesity because of hereditary issues, because of genetic issues, or
Mm-hmm.
simply like that. They might not be eating that much, but there is certain sort of body shaming going on. There is certain sort of blame game going on, which the people surrounding them tell, Ki, no, no, you are obese because of your own lifestyle. Sometimes it might not be the
True.
right thing. People who are fat or people who are obese, they're also depressed. They are also concerned about themselves, and once you tell it is because of you, you are actually pushing them the other way.
Absolutely.
We
Sure.
have to accept this disease, this obesity, as a disease. If you can go to a doctor for a simple white spot on your skin, why can't you go to a doctor for this disease? Take it as a disease. Okay. So
Exactly. Yeah.
don't feel shy. There's no need to feel shy, because once there is a cure which a doctor can offer you. And we don't say that you are directly going for surgery. We definitely have a team of dietitian. We have a team of yoga instructors, or we can help you with getting this
Mm-hmm.
getting help from other individuals also.
Mm-hmm.
It's only when you have exhausted all the things that you should be going for a surgical procedure. But don't feel shy. That's what I want to tell everyone.
Sure. Thank you so much. It was pleasure having you here with us on this topic, because this topic wasn't done on our channel, and I think this is something I think which everybody would want to know, and they can start sharing with their family members also, because this is a message which should go to everyone who is facing this challenge and disease. They can actually consult the right person. They can actually take out help, seek for help, and get the right treatment done. So thank you so much, Dr. Madan. It was great having you here.
Yeah, thank you. Nice being here. Thanks.
Thank you so much. Bye bye.